8 bones in one complex systems. The carpal bones are 8 in number. They are found within the wrist region of the body. So the carpus or the G carpus means the wrist. So there are 8 in number arranged in two rows. We have the proximal and the distal row, each with the 4 bones, giving us a total of 8 bones in number. So here's a diagrammatic representation of the carpal arc. We have the pisiform bone, we have the triquetrum, hamate, we have the capitate, the trapezoid, trapezium, and the tubercle. So these together form what we call the carpal arc of the wrist. So the proximal row consists of 4 bones and they are arranged from lateral to medial. So from the lateral we have the scaphoid bone, then followed by the lunate bone, then the triquetral bone, and then the pisiform bone. These bones form the proximal row of the carpal bones from lateral to medial: scaphoid, lunate, triquetral, and pisiform bones. Then on the distal row, again from lateral to medial, we have the trapezium, trapezoid, capitate, and hamate bone. So from lateral to medial, trapezium, trapezoid, capitate, and then the hamate bone. So here is a mnemonic for the carpal bones that you can use to easily remember the bones from lateral to medial. Again, from the proximal to the distal row. So the first 4 bones, that is scaphoid, lunate, triquetral, and pisiform, these 4 form the proximal row. Then the last 4 will form the distal row. Then from lateral to medial, lateral to medial. So the mnemonic is: she looks too pretty, try to catch her. She for scaphoid, looks, lunate. Then 2 for triquetral, pretty for pisiform, try for trapezium, 2 for trapezoid, catch for capitate, then her for hamate. So the mnemonic is: she looks too pretty, try to catch her. For the scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, and hamate. So that is the mnemonic for the carpal bones of the hand. So here is a diagrammatic representation of the carpal bones. So we have the scaphoid bone. So again, arranged from lateral to medial. Lateral to medial. So from the lateral we have the scaphoid bone for she, then look for lunate, try, she looks too pretty, 2 for triquetral bone, then pretty for pisiform bone. So this is the proximal row: scaphoid, lunate bone, triquetral bone, and then the pisiform bone. These together form the proximal row. Then we have the trapezium, trapezoid, capitate, and hamate. So the mnemonic here is: she looks too pretty, try to catch her. So scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. So this forms the carpal bones of the hand. So the proximal row for the scaphoid, lunate, triquetral, and then pisiform. Distal row: trapezium, trapezoid, capitate, hamate. So this is the proximal part, this is the distal part. Then let us look at the identification of the individual carpal bones. So for the scaphoid bone, it is boat shaped. So it has that shape of a boat, and then it has a constriction, that is the neck. Then it has a tubercle on the distal part of its palmar surface. Then the lunate is moon-shaped or crescentic. So it is moon-shaped. For the scaphoid, it is boat-shaped. Then the triquetral, it is pyramidal in shape, has a shape of a pyramid. Then it has an oval facet on the distal part of its palmar surface for articulation with the pisiform bone. Then the pisiform is P-shaped, oval facet on the proximal part on its dorsal surface. So the identifying features of these bones, you can say the scaphoid bone is board-shaped, lunate is moon-shaped, triquetral is pyramid-shaped, then pisiform is P-shaped. Then for the trapezium is quadrilateral in shape and it has a groove and a crest on its palmar surface. Then the trapezoid is shoe-shaped. Capitate is the largest carpal bone and has a rounded head on its proximal surface. And then the hamate is wedge-shaped, hook-like process that projects on the distal part of its palmar surface. So those are the identifying features of the carpal bones. So here is another diagrammatic representation of the carpal bones. So here we have the hook of the hamate bone. This is the hamate bone, so here is its hook. Then we have the capitate bone. Here is the pisiform bone, the triquetrum, lunate, scaphoid, then the tubercle of the scaphoid, trapezium, tubercle of the trapezium, and then the trapezoid. So these are the carpal bones. They are 8 in number. Let's look at the ossification. The carpal bones are cartilaginous at birth. So which means that during birth they are cartilaginous and each carpal bone ossifies by one center. So each has one center of ossification and all of these centers will appear after birth. As I've said, the carpal bones are cartilaginous at birth. The ossification centers appear after birth. Then the capitate bone is the first to ossify while the pisiform bone is the last to ossify. The centers of ossification will appear from the second month to the 10th year of life. So from the second month, we have the ossification of the capitate bone. Then on the 10th year of life, we have the ossification of the pisiform bone. So why is ossification of the carpal bones important? This is because it helps in the identification of the age of the pediatric patient. It helps in determination of the age of the pediatric patient. Thank you for